What's up, everybody? Thank you so much for tuning into another episode of Conversations with the Coronavirus Survivor. I'm your host, Marielle, and we are so grateful that you're tuned in. If this is your first time viewing the show, we're excited that you are watching. We are really committed to making sure that you all stay engaged and informed as we keep navigating the waters of coronavirus. We've seen that this virus has had so many lasting and unfortunately devastating effects, not only in our country, really in our world. We've seen that we have over 3 million cases reported, cases here in Georgia, Texas, Florida, and so many other states are on the rise. And so it is very concerning. So today, we're actually going to give you another medical update with our friend of the show, Dr. Tamika Blake. And so could you just help me welcome her to the show? Hi,
Hey.
Dr. Blake.
Hi, how are you?
I am wonderful. Thank you. I'm a little concerned. That's really where I'm at right now. I'm a little concerned.
Yeah.
The last time you were on the show, we talked about how this started and how we got to this point. And so I think today we really should focus on where we are right now and where do you see this really going for future? So as I stated in our opener, we have seen spikes in cases in Georgia, Florida. We've seen it in Texas. And we've really seen it in a lot of the states that opened up early, right? And so just kind of from your medical perspective, why have we seen these huge spikes in cases when it looks like we were doing better? The cases were going down, and now we're seeing this huge spike. So why do you think that is?
So, when we all started this, pretty much everything for the most part, we shut down. We were staying at home, and really that was so key to allow the hospitals to prepare, right? They wanted to make sure that if we have had a significant amount of cases, like in New York, they didn't have time. They were just thrown into the den to take care of a lot of sick patients because they were the epicenter. But a lot of the other states were getting prepared for all the patients that they were potentially going to get the virus. Now, it worked, right? So a lot of states saw some cases rise. They had like what we call a peak, and it started to go down. So we were like, yes, we seem to be getting over that hump after a month in. We were home for pretty much call it 2 months. And then something changed. We started to reopen. And there were some states who closed last and reopened sooner. Our lovely state to me that I live in, Georgia. And that comes with the price. So we're like, yes, we can go back out. We're opening back up. The stores are opening up. And it comes with the price. So that is the variable that when we were looking at these graphs, we wanted to basically get that peak and then come back down. What happened is we didn't. We stayed right here. So we're still in that first part of this. Like it's the gift that keeps unfortunately giving, right? And this is not wave 2. This is still wave 1. A lot of people are like, oh, this is wave 2. No, summertime was supposed to be down. We're supposed to have less cases now in the summer. We don't because we're moving around. That was the variable. Like all the data, all the graphs that they were showing, that was assuming we were social distancing, less mobility. But we got our lives back, right? We are able to get out, move around. But there comes with that, there are some places where universal masking in certain states are not mandatory. Up north in New York, you go into the store, you need to wear a mask. In Georgia, it's not required. Certain businesses that are putting, their foot down to make sure that you can help keep other customers safe. So that's where we really are. We just went from this peak to not so peak to now it's getting out of control again.
Absolutely. And I'm really curious as a medical professional how you have looked at the landscape politically, because it seems like the virus has really become politicized, right? Right here in Georgia, we're seeing the governor suing the mayor of Atlanta because she wants to make it mandatory for masks to be worn in like, public spaces to at least help
Hmm.
with that. So I think on the last conversation that we had, you were really talking about the importance of wearing the mask. So when you're seeing this play out, like politically, as a healthcare professional, how does that make you and your colleagues feel? Because you all are on the front lines of this thing, and to see there be this warring almost of invading people's freedom by making them wear a mask. Like, how does that make you all feel? And like, what are you all feeling as you're watching all of this unfold?
I will say it's incredibly frustrating because when I go to work, I work in a hospital institution that requires me to wear a mask, right? And then you have the public health entities. The CDC has already put their stamp down and said wearing a mask in public is recommended. So we know how the virus is transmitted through respiratory transmission. And if there is, and I'm not saying it's 100%, but if there's any barrier that we can place that can help us to decrease the risk of spread, and now we're having to fight based on your political party what's best for the people. Like we've already been told. You have, the public health doctor, everyone looks to Dr. Fauci on a lot of the news outlets that are saying that masking is key. So what is there to fight about? Why are we still questioning what we should be doing? So it's so frustrating. Like I said, I have to wear a mask for like 10, 12 hours a day when I'm working and seeing patients. And, we're not saying you have to wear a mask in your home if everyone's well. Just when you go to the grocery store, how long are you going to be at the grocery store? How is that infringing upon your freedom rights? I think we all have a sense of personal responsibility that can help for the greater good. So don't wear it for yourself then. Wear it for the neighbor. Wear it for the 80-year-old grandmother that has to go to the supermarket because she doesn't have any family that lives in the state. She has to go get her necessities. She's taking a risk by going out and she's having to contend with others that don't believe in masking. So I said it before, masking is key, and that still hasn't changed.
Absolutely. Because since we're talking about, where we are now and then potentially where we'll be in the future, if we keep going down this road of people being resistant, of people like, I don't need it. Do you see the coronavirus getting better at any point if we keep going down this road of not really social distancing, not wearing masks when we're out in public spaces? Like, what do you predict that where will we be in like 4 months from now?
I will tell you, I was having this conversation with my husband, and we were talking about we're huge, huge news watchers. And when this all started, we were looking at other countries, like particularly Italy. And they're like, oh my gosh, what's going on in Italy? Like almost like this sense of arrogance here, like, oh, that'll never be America. That'll never be the US. Look at us now, right? So if we continue to do what we're doing and say like masking is not key, there's some places where potentially looking at changing, we started dining in. Is that a good thing to do? So we have to really take all of these things into consideration. And vaccination is really where this changes, right? And
Right.
a vaccination process takes time. We have over 375 million people. We don't want a vaccine that we think works. Are you going to take a vaccine that you think works? You want something that the science shows evidence that is going to vaccinate a huge population of people. So, do I want them to rush it? No, I want it done correctly. I want the same process that's been done for all the vaccines to be done. I don't want shortcuts. Because what happens if there's a shortcut, and not to say that there is, and you're that person who gets that vaccine that was completely normal and entrusting in our public health. You see what I'm saying? And I think
Yeah.
vaccination is key, but we want it done correctly, and it takes time. And we know typically that process can be from a year to 18 months. And what happens in the meantime? We keep doing what we're doing. Masking. I mean, I remember when I first came on this show, one of the things I wanted to impart to everyone was get used to the uncomfortable. Get used. This is not think long game. I think is what I said. This and I've obviously 4 months later we're like, uh-oh, we're in the fall. Kids are going back to school. Oh, are they going back to school? There are a lot of places that are now virtual. So this is what I was saying all along. This is not something that just goes away. So it's just something that, yes, of course, with anything, I have hope, I have faith, I have a firm foundation. Because without that, you have despair and hopelessness. And that is not the path I choose. But in the meantime, it's just faith without works is dead, right? We have to put in the work. So you assess your risk. If you have medical problems that put you in a higher risk category, cancer patients. We've seen that patients that have hypertension and diabetes are more likely to have complications. So you assess your risk. So you have to make a decision if it's best for you to go to that indoor function that they're going to social distance. It may not be. You may choose an outdoor. Now, first stay home. Now it's social distance, wear a mask, hygiene. I don't think the country's willing to completely shut down again. I'm hoping that's not where we have to get to, but we can do something about it. In the state of Georgia, 50% of the public wear masks. So if we can do something about it and it allows us to have some sense of quality of life in a pandemic, why not do that? So, that's where I see where we're going, that the personal responsibility isn't, if there was now a time to do something for the greater good, now is the time. Now is the time to have sense of
Absolutely.
community. And I think it's so important.
Absolutely. You mentioned fall time in school. So I kind of
Mm,
want to, I can't let you go without us talking about that. So I work in higher ed, right? And I have to be very honest with you. I am very concerned because I think a lot of secondary education, so we've seen elementary schools, middle schools, high schools, have made the decision, and rightfully so, of being virtual, and then just keeping an eye on how this plays out. But where we have not that same decision to be made is in a lot of our collegiate spaces. And if you've ever been on a college campus, you know that it can be definitely, like I always say, it's like a petri dish for bacteria, germs, because things spread so quickly. And so I work at one of the largest universities in the state. And
mm-hmm,
I have to be very honest with you. I am not comfortable with the game plan as far as the protection of the students in classrooms. And so just kind of wanted to pick your brain about, from a medical perspective, if we are going to really try to get a handle on this thing, what are some things that we can do in the educational space to protect ourselves and to make sure that we can try to prevent the spread of the virus as much as possible?
So, and personally, I think we're all, if you're a mother who has children, I'm a mom of three children, two in elementary, and a soon to be freshman in college. And we've been having those same conversations. And, I think of the businesses first. So when I first started to venture outside of the home after we'd all been quarantining, one of the places I first went to was a nail salon. And I was like, oh gosh, I'm not too sure. But I did a lot of research and, they had appointment only. You could not get in without a mask. You had to have your temperature checked. You had to sanitize before you touched anything. So, there were certain rules that were put in place. So there should be similarly a process if you're going to have any type of in-person type of, function for schools. And for college campuses, gatherings and mixtures may not happen. I've told my son, be prepared that your freshman year is not going to be the typical freshman year. Because we have to protect, I would never want, a professor or someone or the children, my goodness, they to get, well, they're adults now, I call them children, the young adults to be affected by the virus as well. But how do you do that? I know his school is doing a hybrid. The dormitories. Typically, I call it, like you said, a Petri. My term is COVID land. Like when I went to the mall recently and I had to run out of there because I went to the food court and I told my kids, I said, someone in this room has COVID. They were like, ugh. I said, look around. So we were not in there. We took our food and we bolted out of there. So, the dorms now are having to contend with that. So now you have students that have nowhere to live. It just so happened that my son wanted to live in an off-campus apartment, so he secured housing with his two other roommates. But the dorms are having to change their process where they would stick two or three and I guess maybe one room. Now you're getting a single room. They have to social distance. And that's still a risk because of the amount of people that are going to be in the dorms. So what I can say is process. You know, I'm not saying that we should not have schooling and we should just say forget 2020 fall school. No, we need to have some sense of normalcy, but in the sense of normalcy, there has to be a plan. There has to be a plan for how you are going to conduct classes. Then there has to be a plan if someone gets the virus. You may have a class where you do a smaller class of 12 and someone contracts the virus. What are you going to do? Now you're going to have to notify those students. They're going to have to quarantine. Now you have to have a process for how are they going to continue to learn in quarantine. And they have to be able to get a test. That's why testing has to be more available, right? So there's so many pieces to the puzzle. And I will say virtual learning, I understand we have to protect the children as well as the students, but I am so highly concerned about our kids, particularly our elementary school kids. You know, the school day is such an important part of them. It's like how we get up and have a career, we go to work. That's their job, right? And that has been disrupted. And there are many that the virtual environment does not work, will not work, doesn't allow for the attention they need. There's going to be so many kids that are left behind. And the virtual experience is going to vary per schooling experience. You know, there are some mothers and fathers that have to work. There are going to be a lot of parents that will be making decisions about, should I go to work? But if I don't go to work, I can't pay the bills. So, Johnny, you may have to stay home today and do your virtual alone. There's going to be kids left home alone in ages that probably are more vulnerable. Food security. There are kids that got their meals at school. And if there is one thing I know, you cannot learn when you're hungry. So there are so many issues that as a medical professional in the public health realm, and particularly when you look at healthcare disparities, who are going to be affected, right? So if you have the luxury to stay home with your job, typically those jobs require a higher level of education. So if you are in a socioeconomically disadvantaged group, and particularly if you're in like a Black community or minority group, if you're working a lower income job that requires you to go to the grocery store, requires you to go to that retail store, you may not have the luxury to stay home and be there and homeschool your child. You know, you may not have meetings to take from home. Your job is at the physical environment. So there's so much issues that I think we just need to really try to plan. And I understand virtual is particularly sounding like the way until further notice. But I think we have to be able to get into the communities that are going to be mostly affected by that.
Absolutely. And you bringing up children is such an important point, because there's something I wanted to ask you that we didn't see at the very beginning of this thing. And I even think in some cases people are like, well, kids, they probably can't get the virus. It's just mostly adults. Well, what we've seen now is, and I want to say it was Texas. I think I was reading an article that they were saying that they have really seen a high percentage of children, I'm going to say under the ages of 12, um,
Mm-hmm.
getting a form of the virus, but it's looking a little different in an adult. So just kind of wanted to ask you, have you seen any cases where there's been children? And if you have, how have those symptoms showed up? Are they the same as the adults, or does it look a little different in children?
So in the middle of a pandemic, you have to remember that that common cold that comes in could be COVID, you know, and that's where it makes it difficult, because if I have a patient that comes in with a pediatric case with their child and they're having a fever cough, typically that may just be a regular virus, but how can I be sure it's not COVID? So they may present similarly to an adult where they may be coughing. And what I tell them is, you need to get this child tested because I can't ensure that it's not coronavirus. And then you have the other spectrum where it looks different, where they have like this multi-inflammatory response, where you can have a rash and they're really sick. Particularly, these cases are the ones that we're seeing that may end up hospitalized. The good news is majority of those children, even in that syndrome, do get better. But it's not, nothing's 100%. We're still seeing cases, like you said, we're seeing some cases that are increasing in that population. So no one's immune, right? Everyone, whether you're young, you're old, you're a child, and even infants. I've heard of a case where a newborn, and thank God they were okay, they contracted it from their father. And it was only, and actually, they, what happened was I believe the child ended up having a fever and they tested, thankfully. They ended up having the virus. And then that's how they traced it back to the parent who thought they were fine. They thought it was just a regular cough. So we have to just be very vigilant and understand that, you know, why are we taking the chance? Why are we, you know, we don't want to, this is not something you want to get. I hope no one's out there thinking, oh, I'll just take my chances. If I get it, I'll be fine. What if you're that one that doesn't recover? What if it's that child that has the severe inflammatory response that does not recover? And those, as we know, are higher in our Black and brown communities. You know, what
Right.
if that happens? You don't want to be that test case. You don't want to be that one death or a few deaths that have been found to be affected.
Absolutely. So we all know that the key to this is testing and being able to have access to testing. So looking at where testing is right now, and if it doesn't get any better, or what needs to happen for testing to get better, for us to make sure that we're able to test the population in a timely fashion, and that tests are still readily available, because I think it's not even still right now as readily available as possible. So in your medical opinion, what needs to happen with testing in order for us to get better in this thing and get on the other side of it?
Our governing officials have to do right by us, and they have to make testing available. It's not well, we don't need so many tests, or, and that's where, unfortunately, the politics come into play. Because then sometimes I wonder, well, do we want to know how many cases we have? We should. How are we going to mitigate this thing? You know, because the numbers don't look great. And I will tell you, there are a lot of people who have had the virus that never got tested. If you're going to get a test and you schedule a test and they say come in 2 weeks, are you going to go? I'm better now. Why do I need a test now?
Good.
Does that make sense at that point? It should be readily. I mean, one thing that I've said to all my patients, because I sense that frustration, right? They'll come in and we'll see them and we'll say, we think you may have coronavirus. Okay, doc, test me. And I'm like, well, it's not that easy, I'm going to give you a list of places that you can go to. Well, why can't you test me now? And I'm like, well, we don't have the ability to test everyone that presents it. Well, they just look at me like I'm crazy and I'm having to walk them through this. And I say, if it was up to me, everyone gets a test. I can treat you medically. I can make you feel better if, you're having symptoms, nausea, vomiting, diarrhea, give you some for your cough, make your lungs feel better. But I don't control the ability to test. The tests come from somewhere, you know?
Yeah.
So the powers that be, the local and governing authorities for all of the different states, we are the United States. One state should not have better availability of testing than another. Testing should not be that hard. You should not have to drive. I had a case I heard where someone waited 3 hours in a drive-through to be tested.
Jeez.
That should not be the case. So, this is where you write and you try to get the governing authorities write letters to the folks that make the laws to say, hey, we are having difficulty getting the community tested and they're going back out into the community and have no idea and continue to spread the virus. We have to be able to manage this. So testing is not something that's a one. And I've heard patients, and this is one thing I do want to stress. I've had patients that say, I tested negative last month. Okay, the pandemic is still here. It has not gone anywhere. So you have symptoms now. I understand you were exposed a month ago and you tested negative, but you have symptoms now that I'm telling you fall within the symptom categories of COVID. So you need a test now. And the best time to be tested is when you are actively having symptoms. So that's another misconception. And then the other issue is sometimes you have clear symptoms and your tests are negative. You may have a false negative test. So don't be, particularly I've heard that in families where they go home and they're like, I'm negative, and they're like hacking their lung. I'm like, no, still mask because you're still having symptoms. And there's a chance that your test was negative, but you can still have the virus. And you don't want to spread that on to your family members. So you should still be isolating in the home. So testing is a continuous process, and it should not be something that should be a hindrance or a barrier. And we have seen that there's definitely some issues and difficulties in getting testing in this country, and it shouldn't be that way.
Wow. I can't even begin to imagine what it's like right now to be a medical professional in any way, shape, form, or fashion. And I'm concerned for our medical community, and we've seen that so many doctors, nurses have contracted the virus, and then just watching different news programs where they are basically doing a day in the life of what it's like in the ICU unit, and that not everybody has enough PPE and they have to consistently recycle it, or seeing our medical professionals in trash bags because there's not enough PPE to go around. So my question to you is, how can the general public, our government officials, how can we support the medical community more throughout all of this? Because you all are on the front lines of this thing, and I've been very disappointed with what I feel has been a lack of support, lack of care in a lot of ways. And then not even listening to medical professionals when they're saying this, and we're politicizing things, and we're putting so many families in jeopardy. So how can we support the medical community more, as you all try to navigate this thing too? Because there's still a lot of unknowns.
One thing I think that would be important is to actually listen to the medical professionals. And I'm pretty sure a lot of my colleagues have been saying this from the beginning. And number one, wear a mask, right? We have the Center for Disease Control. That is the website that they point a lot of the public to in regards to coronavirus. That's one of the mainstays of all of the information that they have placed, and we're still struggling with that. So, listening to public health officials, because it is not a good look to have patients present to emergency rooms in ICUs and you're worried about ventilators availability. This is the United States. We have some of the best, the brightest. A lot of people have gone to school for a very long time to be able to care for people for this very day, you know, emergency medicine, we would read about this, right? In preparation for the disaster, for any type of process that would come into our environment, being prepared, wearing the PPE. We are now in the thick of it. We are doing it. We are every day doing exactly what we need to do to keep you all safe. So we're just asking the public to heed to those public health advisories. Not to, do social distancing when you are out in the public. So there's so much things that the public can do to help and hopefully decrease the spread of the virus. And I think it's just important. I worry when I see us more apt to follow conspiracy theory before the medical professionals. And I know we're in the day of social media and there's so much information out there. You're trying to figure out what's true, what's faction, what's fake, what's myths, are out there. But I appreciate the forum for allowing myself and other medical professionals to speak in this capacity, to let others know that this is a real virus. We're contending with it every day. So when patients come and they're like, are you seeing? Absolutely, we're seeing a lot of corona cases. Georgia is hot right now. Red,
Yes.
on fire.
Yes.
Every emergency room, is really having to deal with the patients and the load. And, because one thing I can tell you personally after having done this for a few months, we are doing all we can to be protected and protect others. So PPE works, if you're getting shields, you wear your mask, it works. I feel extremely more confident working in the environment, having that available. So making sure that the government is supplying, and I think the time that we had till now has really allowed hospitals to have adequate PPE. So I'm thankful for that. But we have to, now that the cases are rising, make sure that we continue to have that. So that's really my plea.
Yeah. So as we wrap up this conversation, and we have given a lot of advice and projections. What are some lasting words that you want to leave with the audience as we keep going through it and we try to get to the other side of this thing?
I think the sense of community is key right now. There are going to be a lot of people who can help others during this time, um, particularly for kids who need help with schooling with kids. If you're a teacher and you can help and you're not having to actively be in school classrooms virtually, help the mom who has to go to work with her kids at home. There's going to be a sense of, now more than ever, we've got sense of community is going to be so key, in addition to doing all the things personally to help contain the spread of the virus. And I think having hope, I still, when I go to work, I try to smile. And it's so hard because they're like, are you smiling? You having a mask? And they'll say, how are you doing? Like it's a good day. They're like, wow, Doc, you always have a good attitude. What else should I have? I have to take care of patients who depend on me. You know, when I have a daughter who's feeling like she may not see her mom, who's an elderly female who's now contracted the virus at a nursing home, and I see those tears in her eyes, I can't have her look at me and see despair. There has to be some glimmer of hope. So I will continue to have hope. I will continue to have faith. But there are things we could do in the meantime. Be there for one another. Personal responsibility. Do what you can do to help contain the spread of the virus.
Well, Dr. Blake, thank you so much for taking time out of your schedule to talk to us, to educate us, and just thank you for what you do. We are so grateful to you and your colleagues for just being heroes. I mean, I can't even imagine what it's like being on the front lines of this thing every day. So that's why, in what I
Mm-hmm.
can do as an individual, I'm going to do, which is wear my mask, social distance,
Yay.
and just be responsible. So that's what we want all of you all to do out there. Again, we said it before, like wearing your mask is really loving your neighbor, really take care and concern for yourself and for the people around you, because I think that that's really important. We are so grateful to Dr. Blake for just sharing her wisdom and her time with us. And we thank you for watching. We hope that everything she said in this interview, and that you take that to make responsible decisions. Until the next episode, y'all, we'll see you then. Peace.
Bye. Take care. Bye.